Hi, my name is Emma. I'm a nursing student from the University of Wisconsin-Eau Claire. Recently, I've been working in collaboration with CAP Agency Head Start and Early Head Start, and together we've been looking into resources to overcome barriers to attending well child visits. So throughout the course of this presentation, we'll look at well child visits, the importance of them, frequent reasons why they're missed, and then I'll share some resources to help overcome these barriers within our community. CAP Community Action Partnership, Early Head Start, and Head Start programs are income-based early childhood education programs that serve the Scott, Carver, and Dakota counties in Minnesota. These programs are federally funded and offer free early education and parent support services for prenatal mothers to children up to 5 years old. Head Start is a center-based program for children ages 3 to 5 years old. A large importance is placed on the partnership between teaching staff, family service staff, and parents. This is a full-day program focused on school readiness and providing tools for the entire family to be successful. 2 healthy meals and 1 snack are provided throughout the day. Families are responsible for their own transportation to Early Head Start services. The Early Head Start program serves children from birth to 3 years old as well as expecting mothers. In this program, weekly home visits take place with a family educator and last about 90 minutes. During these weekly visits, priority is placed on promoting parent and child relationships, setting and achieving goals, early childhood education, parenting skills, health, and safety. Both Head Start and Early Head Start programs offer a variety of different services aimed at supporting the whole family. This includes oral and physical health education and services, curriculum that is developmentally appropriate, social and emotional education and support, parent meetings and family fun events, one-on-one home visits in order to provide parent support and resources, and a supporting and welcoming environment for children with medical or developmental needs. Early Head Start team members noticed a trend of missed well child visits at the 15 and 18-month marks. Together, we conducted a survey within Early Head Start families to gather more information on this topic. When parents were asked, "Have you ever missed a well child visit for your child?" 70% of respondents said no. 20% responded yes, and 10% said, "I'm not sure." Those who responded yes were unsure of the age their child was when the well child visit was missed. Well child visits are extremely important as they provide preventive care to children, including immunizations, screenings, assessments, referrals, education, management, growth and development, and more. During your child's well checkup visit, many important topics will be discussed, like immunizations, growth, development, well-being, nutrition, sleep, safety, and more. This image shows the recommended visit schedule for children up to 18 years old. As you may notice, vaccines do not occur with every visit. Many people may think that if an immunization is not administered, their child's visit is less important and can be skipped. However, this is not the case. During your visit, your provider will measure and track many important factors that are essential to your child's lifelong growth and development. These things include a physical exam, weight, length and height, hearing tests, sleep, car safety, general safety, developmental and behavioral screening, maternal depression screenings, important milestones, oral health, important labs, schooling, and much, much more. Many people may think that because they brought their child to the doctor for an illness, they don't need to schedule a well child visit as well. However, both visits are extremely important and serve very different purposes. A sick visit addresses acute illnesses or symptoms like fever, sore throat, cough, rashes, and more. These visits are focused on diagnosing and treating an illness. The purpose of these visits is to evaluate symptoms, perform tests, and provide a treatment plan. A well child visit is a preventive checkup that is focused on monitoring overall health and development. During these visits, your physician will perform a physical exam, examine growth and development, discuss nutrition, sleep, mental health, and more. These visits are essential in order to monitor developmental milestones. Before your child's well visit, it can be a great idea to write down any questions or concerns you want to discuss with your provider, preventing you from forgetting any topics you may want to talk about in the moment. While we can acknowledge the importance of well child visits, we also must acknowledge the barriers that make them difficult to attend. Research shows that transportation, difficulty taking time off work, childcare for other siblings, language barriers, and other priorities or social factors can make attending these appointments extremely difficult. Today we are going to discuss each of these barriers and resources within the state of Minnesota to overcome them. Based on our survey conducted, the early Head Start families find the most difficulty with lack of appointment availability, language barriers, and difficulty finding childcare for other children. So in this point in the presentation, I'm going to talk about resources to overcome the barriers we discussed earlier. So in order to combat transportation difficulties, the Minnesota Department of Human Services offers non-emergency medical transportation, or NEMT services, for medical assistants, or MA members. The service can be used for non-emergency medical appointments, one-way or round-trip. There's a 30-mile limit for primary care providers and a 60-mile limit for specialty care providers. For more information, call the information desk at 651-431-2000 or visit their website online. Another resource to overcome transportation difficulties is the Help Me Connect website. This is an online search tool to assist families in finding transportation services in their local community. To use the website, you simply enter your location into the search bar. The Help Me Connect website is created in collaboration between the Minnesota Department of Children, Youth, and Families, Department of Education, Department of Health, and Department of Human Services. Health Partners also offers its own non-emergency medical transportation for eligible health partners, medical assistants, or Medicaid members. This transportation service is available at no cost for members of Health Partners, PMAP, MSC Plus, or MSHO plans. This is also available for children and pregnant women on Health Partners Minnesota Care plans. There's a 30-mile limit for primary care providers and a 60-mile limit for specialty care providers. To schedule this service or gather more information, call 952-833-7400 or visit their website online. Health Partners has also teamed up with Unite Us to offer a wide variety of resources to the community. On their website, you can search for resources based on your locations. You can search from resources nearby, clothing and household goods, education, employment, food assistance, housing and shelter, income support, and individual and family support. You do not have to be a Health Partners member to use these resources, and many of them are free. However, depending on the program, there are eligibility requirements and sometimes fees. This is a great tool to use as a lot of different resources are offered, and the website is very accessible and straightforward. Another barrier for scheduling well-child visits is difficulty taking time off of work. The state of Minnesota offers Earned Sick and Safe Time, or ESST. This law, enacted January 1st of 2024, requires employers to offer paid time off to employees to be used for medical, caring, safety, closings, communicable disease, and bereavement reasons for both themselves and family members. This covers preventive care or well-child visits for an employee's children. This covers full-time, part-time, and temporary workers that have worked for an employer for at least 80 hours in a one-year period. 1 hour of PTO is earned for every 30 hours worked, and up to 48 hours can be accrued each year. For more information, call 651-284-5075 or visit the Minnesota Department of Labor and Industry website. Another barrier to scheduling well-child visits is childcare for other children. Head Start itself is a great resource for childcare if you don't already participate in this program. As previously mentioned, Head Start is a preschool, center-based, full-day childcare program for children ages 3 to 5 years old. Those who are automatically eligible for the Head Start or Early Head Start program include families who are receiving public assistance, experiencing homelessness, are the current family of a foster child, or living at or below the current federal poverty level. Although these programs automatically generate eligibility, enrollment in the programs is not guaranteed. The Help Me Connect website is a wonderful resource to search for childcare as well. The website offers many great free and low-cost programs for families. Among childcare and transportation, the website also offers resources for pregnant and expectant families, healthy development and screening, developmental and behavioral concerns, disability services and resources, family well-being and mental health, American Indian families, caregiving and community support, dental and healthcare, basic needs, and legal services. Another great resource is the YMCA. While the parent must remain in the building while their child is using the child care services, this can be a great resource. While children are being supervised, this allows parents to exercise, relieve stress, participate in group exercise, and more. Even if parents are not exercising, this time can be used to do things like shower, read books, search for jobs, de-stress, and more. Things like swimming lessons are also offered at lower prices for YMCA members. While the gym membership can be very expensive, the YMCA offers financial assistance to those who qualify. You can apply for financial assistance by submitting low-income documents and filling out an online application for a scholarship. Then a scholarship amount will be determined from that point forward. Another resource to use to increase access to childcare is an early learning scholarship offered through the Minnesota Department of Children, Youth, and Families. Children must be aged birth to 4 years and not yet attending kindergarten. Families must have an income of 85% or less than the state median income before taxes. Families with income at 47% or below will be given priority, as well as those that are receiving assistance from federally funded programs. These programs include Head Start, Child Protection, Foster Care, Child Care Assistance Program, and more. Families can apply online and, if approved, can use scholarships at any child care or early education program in Minnesota that participates in Parent Aware, a child care rating tool. You can apply online and can email any questions to dcyf.elssscholarships@state.mn.us. Language barriers can make well-child visits difficult to schedule as well. However, Section 1557 of the Affordable Care Act and Title VI of the Civil Rights Act of 1964 ensures that programs funded by the Department of Health and Human Services or are covered by civil rights authorities must provide language access services. This includes things like translators, interpreters, and auxiliary aids. By law, everyone has the right to language access. If you are denied this right, please reach out to your local Department of Human Services. While everyone has the right to access a language interpreter, some families have also expressed an interest in learning English. Literacy Minnesota Open Door Learning Centers offer free classes for English, computer skills, English for college preparedness, English for medical careers, citizenship application and interview preparation, and more. Classes are offered in person in St. Paul and Minneapolis, as well as online. They are also offered in the morning and evening. To register for classes or gather more information, call 612-377-5399 or visit their website online. Unfortunately, scheduling well-child visits can be quite difficult due to lack of appointment availability. To best combat this, schedule your appointments as far in advance as possible, especially in the first year of life when appointments are so frequent. You can generally schedule these visits for the rest of the year as well. Once appointments become annual at 3 years of age, try to schedule them at the same time each year if possible to easily remember when an appointment needs to be completed. A general rule of thumb is to schedule well-child visits at least 3 months in advance. If you have more than one child needing a well-child visit, it is possible to schedule both at the same time. Just know that you may need to plan for a longer time period as the visits cannot be completed at the same time, but rather one after the other. If you're bringing in more than one child, you may need to schedule further in advance due to the extended time period needed. Check with your local healthcare provider to determine how far ahead of time these visits can be scheduled. Additionally, many insurance agencies offer gift cards or other financial incentives for completing preventive visits, like well-child visits. If you have any questions regarding incentives, make sure to call your individual insurance provider to gather more information and take advantage of these offers. This brings us to the end of our presentation. Thank you for taking the time to listen. Hopefully we've learned a great deal about the importance of well-child visits, barriers that families may face, as well as some resources to help families overcome these difficulties. Thank you.